Hello everyone, this is Dr. Sharad Bedi. I'm working as a consultant physician and a diabetologist based at Gurgaon. See, today's topic is very important not just from doctor's point of view but from actually patients and caregivers point of view, and that is hypoglycemia. See, what is hypoglycemia? Hypo means low, glycemia means sugar. So hypoglycemia means low sugar, that it falls a certain range. So generally in a non-diabetic person, 70 is considered as the threshold. If the sugars in a non-diabetic person are less than 70, then they can experience hypoglycemia symptoms, right? Every episode is important because hypo can be very frightening to the patient. Let's suppose somebody is driving. It can take a toll on the patient's as well as the other one's life as well. One major limiting factor in terms of sugar control is that our goal as a doctor is to achieve target sugar control but avoid any episode of hypoglycemia. But every day is different, every situation is different, and humans are not computers. So hypos are bound to happen. But with right knowledge and education and little bit of understanding, we can easily avoid episodes of hypoglycemias or can keep them to the bare minimum that they don't affect our quality of life. This can be done by striking a balance between food intake versus the use versus the lifestyle optimization along with the medicine optimization. So altogether it's more like a multidisciplinary effort to reduce the episodes of hypoglycemia. Take it like a first aid for a diabetic patient, the management of hypoglycemia, because this is one thing which can be managed at home and we can easily avoid hospitalization as well as save a life. So you can pause in between, make a small note, and you can revisit them. Let's discuss about some of the common symptoms what are present in an episode of hypoglycemia. See, they can vary from shaking, palpitations, anxiety, hunger, sweating, blurred vision, mental clouding, headache, to dangerous symptoms like loss of consciousness, coma, seizures, and even eventually death, though these are rare, definitely. That is why understanding is very important, because even if it is a rare instance, we can avoid it. The basic problem here is that brain is not getting enough glucose, which leads to a state of confusion and mental clouding, which can force a patient to take a wrong decision in such kind of scenario. Just before proceeding, I will mention two hormones here. One is glucagon, one is adrenaline. These two are released in an episode of hypoglycemia. And in an episode of hypoglycemia, you may experience shaking, palpitations, anxiety, sweating, which I just mentioned. So these are typically the kind of adrenaline rush, and which gives us an idea about whether something wrong is happening in a patient suffering from diabetes, that this is going towards hypoglycemia. Little bit about causes. See, broadly I will categorize them into hypoglycemia in a non-diabetic patient and in a diabetic patient. Hypoglycemia in a non-diabetic patient is not a common occurrence, but it actually requires entirely different workup. So go and meet your doctor in case you are non-diabetic and are experiencing even one episode of hypoglycemia. Let's talk about the common scenario, that is hypoglycemia in a diabetic patient, which is the point of focus of discussion today. Some of the risk factors can be here: missing a meal, delaying a meal, patient on insulin per se, taking extra insulin by mistake. This is one of the common scenarios, especially in the elderly, that they by mistake take extra insulin, right? Excessive alcohol intake, that is one of the very common reasons which can lead to an episode of hypoglycemia. Kidney dysfunction predisposes to episodes of hypoglycemia. Extremes of age, children and elderly, they are more prone to get hypoglycemia because they are not able to completely judge the situation, plus they may not be able to communicate also, right? These are some of the risk factors, and the fluctuations can happen anywhere. So one should always be aware of whether any hypoglycemia episodes are happening or not. So hypoglycemia is sugars less than 70. But there is a little bit of classification, levels of that. So level 1 is that the sugars are less than 70 but are more than 54. That is the level 1. If it is less than 54 but more than 40, that is level 2. One can experience neural symptoms here. If it is less than 40, that is a stage of severe hypoglycemia which can lead to altered mental status requiring assistance by somebody else. So recognized or unrecognized level 3 hypoglycemias can lead to loss of consciousness, coma, seizure and death. This is one such situation which can take a toll on somebody's life. One has to be always careful about it. Whenever you experience any low sugar symptoms, just check the sugars, whether that is a true hypoglycemia or that is just a feeling. If it is truly an episode of hypoglycemia, that is the sugars are less than 70, give 50 to 20 grams of glucose to the patient. Preferably glucose, but any sugar will do. You can give sugar biscuits, you can give sugar water, you can give any cola or cold drink, you can give juice, lime, lemon, whatever you wish to. The idea is to whatever is handy you should give and not lose the time in search of glucose per se. Check the sugars again after 15 minutes. If the sugars have gone above 70, give a small meal or a snack to avoid any further hypoglycemia episode. If the sugars are still less than 70, then repeat the step 1. That is again give 15 to 20 grams of glucose. If somebody is obtunded and is not mentally fully conscious, don't forcefully make them eat or drink something, because whatever you give, that can go into the windpipe and can lead to collapse of the patient. So in such kind of situation, it is advisable to go to hospital. Now, in the beginning, I mentioned about two hormones, glucagon and adrenaline. The symptoms are because of adrenaline, but glucagon is actually one of the management strategies, because glucagon will lead to increase in sugars. So that is directly helpful. It is more helpful in level 2 and level 3 kind of hypoglycemias, which is available as maybe intranasal spray or glucagon injection. Very easy to give, can be given subcutaneously. You can give at the arm, at the tummy area or in the thigh area. So this is especially useful for those patients who have recurrent episodes of level 2 and level 3, are insulin dependent, whether type 1 or late type 2 patients. So but the catch here is, patients in such kind of level 2, level 3 states, they cannot manage on their own. So generally the caregivers, healthcare professionals, school personnel, they are the right persons who should be educated and who should be aware where glucagon is kept and when to give it. They should be more well versed rather than the patient per se. Now this is regarding management. So, but there are few recommendations for diabetic patient. If they follow this, they can easily avoid many episodes of hypoglycemia. One is, when they are going out of the home, always carry some form of sugar. Whether you are able to check it or not, but if you experience symptoms, better to take it so that you can easily avoid any true hypoglycemia episode. Second thing is that carry some ID card which shows that you are a diabetic patient. Because in such kind of situation, if they know that you are diabetic, they can treat your hypoglycemia in a better way rather than not knowing the status at all. Another very important point is, always take it seriously, especially multiple episodes or severe episodes. Go meet your clinician or doctor who is managing your sugars. They may be able to help you out in a better way by revising the glycemic targets as well as by changing the dose of the insulin or tablets or whatever best possible way. See, this is one of the complications what happens, but that doesn't mean that we should not treat diabetes. Diabetes is lethal per se if you don't treat it. But yes, our goal is, as a team effort, our goal is to manage the glucose control by keeping the hypoglycemic episodes to the bare minimum. So just to summarize, hypoglycemia is one of the deadly conditions but a treatable and controllable condition. There are few risk factors we discussed about, that especially type 1 diabetes, insulin dependent type 2 diabetes, missing a meal, extra insulin, alcoholics. They are the ones who are more vulnerable to episodes of hypoglycemia. If it is less than 40, that is actually dangerous and life threatening. You should always take measures before that. Never let it happen, go less than 40. Patients and relatives should be educated enough and they should be aware of signs and symptoms of hypoglycemia to take corrective measures. You can save a hospitalization as well as a life. In case you have any queries, you can always put a question in the comment section. I would be happy to reply that. Thank you.